Cross-sectional studies are also known as snapshot prevalence studies. Number 5 is cross-sectional, and cross-sectional study is known as prevalence studies or snapshots or survey studies. Usually you do survey, like the survey of the census, when a team of census comes to your home and asks for how many people live in your home. Cross-sectional study is not retrospective. Cross-sectional study sees what is happening at one point in time. What is happening right now in the present? You remain in the present. In cross-sectional study, what is happening at one point in. Okay, so now what is longitudinal study then, guys? That is 5B. Write down 5B. Another kind of study design I'm giving you. This is 5A, cross-sectional, but longitudinal study is 5B. Longitudinal study is what is happening at multiple points in time. What is happening at multiple points in time? You will go into the future and collect information at multiple points in time. And both of them are survey studies. So when you give a survey to a population, to some people, one group, again, no multiple groups in cross-sectional. Although I do know there is a cross-sectional study. I know people do cross-sectional study with 2 groups. I know I have been a part of one study. Okay, so that is true. But most of the time, cross-sectional study has only one group most of the time. So don't take me wrong that, oh, he said that cross-sectional study can have only one group. Most of the time, as I said, I'm a part of a study that is going on as a researcher with a group of friends that has 2 groups. Okay, so longitudinal study is what is happening at multiple points in time. Cross-sectional study is what is happening at one point in time. In both, you give survey to a population. And what do you study? Prevalence of a disease. How prevalent is the disease? How prevalent is the disease? Now let's move to number 4, case control study. Number 4 is case control study. What is a case control study? It has 2 groups, case and control. That's why we call it case control. It is retrospective. You go into the past. How do you go into the past? You go into the past of a patient by looking at the history, clinical electronic records, patient history, the files and folders. Case control study. Number 4. Now, case control study has cases and controls. Cases are the people with disease. Controls are the people with a different disease or healthy people. Controls are confusing. People think controls are people who are healthy people. No, controls are people. They could be healthy or they could have a different disease that you're not studying, that you're not focused on. Make sense? So case control study is a retrospective study in which you go into the past by looking at the electronic records, medical records, clinical records, talking to the patient history, taking the patient history, talking to the patient's family or the physician. You collect information and you see, okay, so they had smoking history, they all smoked, that's why most of them develop cancer. Most common example, right? Now, the sampling is done on the basis of outcome. Now, how do I differentiate? Confused, right? Sampling is done on the basis of outcome in case control, but sampling is done on the basis of outcome in case series too. So how do we differentiate? Who will tell me the differentiating feature? In case series, we collected the study, the sample, on the basis of outcome. And in case control, we are again collecting the patients on the basis of outcome. That we know the disease and we are collecting those patients and we will study those patients mainly as the cases. So have I confused you? In case control study, the sampling is done on the basis of outcome, but in case series, the sampling was also done on the basis of outcome. And no such thing is done in cross-sectional and case study. We just decide a population with similar characteristics and we start the study in cross-section. Very good. That's the answer. No control in case series. No control group in case series.